This is Dr. Brian. We're talking about the band system in my arm doctor today. First thing I want to do is talk about the bands themselves. So you have these flexible bands that expand a certain amount. What I do is I start with one band because I want to mimic the therapies that I've been using and trained in and applying for the last almost 30 years. Lymphatic massage, for instance. Lymphatic massage is a lighter, almost a brushing. You get into some people very light. When I've worked with people that have been fresh out of surgeries where they've had their knee surgery done, and we'll start the very next day just lymphatically brushing to get the lymph system moving, right? So lymphatic, you're going to use one band on one roller on the bottom when you start out. So you're just using one just to stimulate. Some people put one band on there and they're like, oh, it's not doing anything. This doesn't do anything. It's increasing their lymphatics. Because we know massage in itself increases blood flow and lymphatics. Very light. I had a really nasty bruise that I worked out, and I had to start at a lymphatic level for about 2 to 3 days. A two-band system is going to be working more of the petrissage or the effleurage, right? You know, it's going to be like if you're at the massage therapist and they're working your body, they're maybe kneading, you know, it's going to be more of that style. We're going to apply a second band just to the bottom rollers. Okay, so we did each side on the bottom, not to the top, because your wrist is the thinnest part of the arm right in here, and it's thicker as you get up into the forearm. So when you're using this, that forearm, if you have two bands on each one, it's going to put a lot of extra pressure on there, because now I can feel that it's putting a lot more pressure on my hand and my wrist right there, and I don't get a lot here until I start getting down into it. With the top has one band, the bottom roller set has two bands, so that bottom's getting more into more of a effleurage type rolling. So with two bands on each, you can see how they just roll right on there. Not a big deal. They're pretty easy to put on. With this one, you can rotate. If you look through the top here, you can rotate your arm, and you're going to feel that resistance in there. And I have the rollers stacked for a reason. I have the two sets because Newton's law is something in motion stays in motion. So the first set of rollers starts the blood, gets the fluids moving. The second set of rollers picks that up and keeps it going. So when I applied the building of this thing to it, and I woke up with the idea, started just writing all this stuff about how does this apply to what I learned in the science programs that I studied. So now the third level, when you get into the third band system, now you're dealing with the deep tissue sports, the neuromuscular release work that I like to mimic with my chronic tendonitis, which is very easily managed now. You have to get in there and work all the way up. So this is what I'm talking about, neuromuscular release. You trap the tissues, glide. I took active release studies, and that's part of it, but I did a ton of neuromuscular massage before I got into that. So the rollers basically mimic like when I work on somebody's forearm, and so when they're moving their hand, they're actually propelling my arm through their tissues. So this is a tool right here, and I lock into it with tension, not pressure but tension, and that tension, when they open and close their fist, if they stop, I stop. I don't move. I'm just there because they're not moving. I have the same amount of tension. They open and close, and then it starts moving again. I haven't changed my tension, but their action works with those tissues. Where a deep tissue massage, you get too deep, people just plow through that, can get really sensitive because you're kind of forcing the issue, I think. So I like the action work. So with the third set of bands, so I'll start usually just, I'll put 3 on the bottom and then just keep 2 on top, because I want to test it and see how does that feel, you know, is anything going on? And then I can start waving or using that action and then propelling so it's doesn't feel too deep. Or you can just use a little bit deeper, more of a sports style deep tissue. So this basically mimics if I was to do forearm work, but I'm getting a little bit more intense and leaning on it, except with this, it'd be like bringing it together. So you're getting it from both sides. And so in some ways, working with your forearm with this is actually quicker. That's why I can use this just for a minute or two versus having to get one side therapy done and then the other side therapy done. So there's that bonus. So in this case, sometimes you almost have to stand up because when you get down in there, it wants to come up. So you have to hold down on the device. And this is where I like to work with the tissues. Now, if you put 4 bands on here, I guarantee you working with the tissues with the movement is one of the ways you're going to have to do it. The only people I've ever seen work with 4 bands are some of the pro fighters that I've worked with, and the gym rats, the people with the big massive forearms are just super strong so their muscles can handle that deeper tissue. But that's getting in there, and that's like trapping that stuff. And you know, they like to get in there and just work, get into those tissues. If you're going to get into 4, you pretty much already know where to go. I'm not going to show you how to do 4 because basically 4 is intense. I don't recommend it unless you are a high-end athlete. But one thing to know about the bands, people ask me, well, how long will these bands last? Well, if you stretch something and hold it and leave it there, it will lose its elasticity over time. But when you engage it and disengage it, engage it and disengage it, it will maintain itself. Boy, I've had some bands on there for a couple years, and before I'd ever even think about replacing them. There's enough in the bag, so if they feel like it doesn't have as much strength, add another one. But I've never had one break. And as well with the bands, what you have to think about, it's a graduated thing. So as you increase and you put your hand in, you can see that expand. So the tension increases, it gets harder as that gets longer, right? But that's what a band does. Just keep that in mind. So when you add 2 of them, take 2 of them sometime, oh, you can feel that way harder to do, right? That takes me a lot more effort to do that. That's like how many people out there in the world work out with band systems. That's why I went with this system versus trying to get some complicated spring system with dials. Now when I'm using 3, that's a lot of pull for me to try and stretch those 3 out. I can do it, but that takes a lot of work. I actually start getting a little cramp right there. But that gives you an idea, the graduated tension that builds up when you add the bands together. This is Dr. Brian Bymers. Thanks for stopping in.